Good afternoon. Uh, you are welcome again to our skills lab. This is Agape College of Nursing, and today we'll be looking at a very critical procedure in which it will be involving us getting invasive, and we'll be doing cannulation, and then after cannulation we'll look at IV care. And then this procedure actually will help us understand the skill that we need to have to cannulate, and then also a skill of being able to clean the cannula and change the cannula whenever the cannula has swelling or has some problems. So I'll take you through the whole procedure from the beginning, and then as I'll be doing the procedure, I'll also be illustrating and probably talking so that you can be able to pick one or two things. Okay?
Yes.
All right. So first things first, we are going to wash our hands. Okay? An antiseptic solution, preferably hand sanitizer or some spirit. And then from there, we're going to get the same spirit and pour it on top there. Then we're going to make the trolley surgically clean. So making surgically clean is just reducing the number of microorganisms on the trolley, because you know this is a sterile procedure. And it being a sterile procedure, we cannot actually subject sterile things to a clean surface. We need to make it surgically clean so that we render it free from non-sporous microorganisms. So when cleaning, I'll start from the left going to the right as usual. From the topmost surfaces to the bottommost surfaces, and then from the furthest to the nearest surfaces. So watch the way I'll clean the trolley from the top. So left, right. This is the second top. There and there. And then I'm going to go like that. So that one goes there. So I've made my trolley surgically clean. So you observed, I started from here, coming to the nearest, and then I went there, coming to the nearest, because this is the topmost, and I'm starting from the left. And then I'll start from the left actually, going this side, because this is the second topmost. The third topmost are these, and then finally the base. We're just cleaning the top part, not the bottom part, because this is where we're going to put our part. So I'm going to push my pack on top like that. Then after pushing my pack, I'm simply going to get, this is a Macintosh, this is a towel, this is a Macintosh. So those of you who do not have Macintoshes, dressed Macintoshes, those that have actually been blended together, you can use these. Okay? But sometimes in your exams, you might find they give you just one that is attached together with the other. Don't get confused. This is simply a Macintosh. Okay, so there, I'm going to stretch the Macintosh like that. After stretching the Macintosh like that, put it like this. And then lift the arm, put it on top. Okay, so the patient should be left comfortable. And then when that is done, then the next stuff that I'll do, I'll be able to get a receiver and push it there. Okay, yes. For putting dates all together. All right. Wash your hands. After washing your hands, open the pack. So when opening the pack, I'll start from the left. There you go. There you go. There you go. There. At this point, I'll get the cheaper forceps. Take them out together. Push the other one back. Okay? Opening. Always start from the left. I go to the left. I go to the left. Okay? Turn it. Furthest to nearest. All these complications, they are not complicated. Just know the principles and it will be over. Okay? There. Remove those. Remove those. take off the two forceps, hold the corners. If you don't find the corner, you do that. You'll be able to find the corner somewhere. And then immediately get the corner, pick it up like that, and then hold. Turn, pushing like that. All together.
Yes.
Get. Turn. Put like that. Put them back. And from there, we're going to open the back. Okay. Get your normal saline. Pour it in one of the empty. Then also get your spirit and pour it in one of those that are empty. And then get your cannulas, drop them there. Get another cannula, open. Oh, it's down. Leave it. That's why you need to have how many? 2, in case the other one drops down. Okay. Open. That's a given set. Drop it there. After you've dropped it there, okay, you get your tourniquet. Get your tourniquet. Okay, so this tourniquet is not surgically clean. It's dirty. Okay, so you need to decontaminate it so that it fits to be there. Okay, so you decontaminate it using spirit. You get a swab from the bottom shelf and then you wipe it down like that. Okay, then after you've wiped it down like that, you can drop it there. Okay, right. After that, you get your surgical gloves, drop them, get your surgical gloves, you drop them there. Okay, so the next thing you do, wash your hands. This procedure called scrubbing. Scrubbing, you wash your hands up to the elbow, okay? And then again up to the elbow. After that is said and done, get your gloves, the surgical gloves, put them on. Remember, when you are putting on surgical gloves, should always be touching the inside. Okay, same thing. Not touching of the outside of the, the inside of the glove. So when you are putting on this one, you touch the inside. When you are putting on this one, you can touch the outside. Okay, so that you don't contaminate. Remember, putting on gloves is a skill. You need to be doing it every day if you want to perfect it. Okay, so put on your gloves tightly. Put on your gloves tightly like that. Put on your gloves tightly like that, so that you minimize chances of contaminating and breaking of gloves. So they need to fit you tightly. Okay. Mind you, you use surgical gloves, you don't use clean gloves. Okay. After that is done, your job is to get this sure that it's closed nicely. This is an adjusting knob. This is the fluid chamber, and then this is the pointer which goes directly to the fluid pack. This is a fluid pack, it's normal saline. So for this fluid pack, I'm simply going to pierce here. Okay. 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 Pierced. So I've connected it, but fluid cannot flow there because I've closed. So after that, I'll hold it nicely like that, and then be able to hang it on my drip stand. Okay, making sure that it doesn't reach the floor. Okay, from there, prepare. Prepare nicely. Okay, and then get spirit swaps. These spirit swaps, this hand will give it to this, and then I'm going to clean the area where I'm going to cannulate. Okay, throw there, get another one, clean thoroughly, even on the bottom, then throw there. And then I'm going to get a tourniquet. It's a tourniquet. So this hand will lift the other hand, the top, which is surgically clean, move it down there, and then tie nicely like that. Okay. So now we are waiting for the blood vessels to engorge, or for blood to accumulate. So we know that for now we are cannulating in the vein. Okay.
Yes.
So I'm simply going to get my cotton wool, and then I'll get my cannula. Okay, the cannula, it has a needle in front there, and then it has these. Okay, and then when you are touching it, you hold it like this, you hold it like that. You see it?
Yes.
Okay, so I'm going to come back like this, and as I come back like this, the cameraman can come closer so that you see. I'm able to see the blood vessels here. You are not cannulating into an artery, but into a vein. So kindly let the people see that. So here we have a vein here. So I'm simply going to go down there. Okay. Have you seen? I'm going at 45 degrees. Then as I reach 45 degrees, I begin to push at 15 degrees. Okay. So when it goes like that, I'm simply going to push out. I'm going to push out the metal needle there. Put it like that. And then close up down there. Okay. After closing up down there, okay, the next thing is to open up there so that blood can begin to flow. Okay. So you begin to see blood coming here. So it simply means that you are into a vein. But that is not proof enough that you are into a vein. No. Okay. That is not proof enough that you are into a vein. Proof enough that you are into a vein. Now it's time you are going to get a syringe. Okay. A syringe, and then you are going to push in a water for injection or normal saline. Okay. So the normal saline or the water for injection is going to be flashed inside there. So can you give me a syringe so that I show you how to flash it quickly? Quickly, behind time. Yes, open it up nicely and drop it on top. Good. So get the syringe withdraw normal saline, and then open it up, and then from there I'm going to do what? To flush. Open up the top there for bubbles to be coming out. So if at all I'm not in the vein, I'll meet resistance and you begin to see the cannula site getting swelling. Okay, it will swell up. It simply means that I'm not in the vein, actually I've gone into the tissues. Okay, that's why it's even swelling. The fluids are not going into the veins, but they are just accumulating where I've just done the cannulation. So I have to remove the cannula and cannulate somewhere else. But if you discover that there is nothing like that, then you just close up nicely there, because blood will be coming out. Okay, and then get your strapping and push there. Okay, get your giving set. This is a giving set. Throw that there, and then put it on the receiver like that. Open it up. Okay, depending on the flow rate. Okay, so if the doctor ordered 10 drops per minute, you put 10 drops per minute whilst observing on the watch how many drops they are. So usually that's how it should be performing. See, it's dropping there, isn't it? Yes. Okay, so you are counting the number of drops. 1, 2, 3, 4, 5, 6, 7, until you reach the actual number that has been prescribed by the physician. Okay, after that you then connect it nicely there, and then you even put your strapping there so that it's so. This is exactly how it will look. Okay, close up the top part like that. Then you've actually done what is known as the cannulation of the patient. The procedure ends there. Push your stuff down there, put those things there, and then remove your drips and everything. Okay, thank you so much, cameraman.